Well, I am a regular visitor more than I would want to be, and I have no complaints about them at all. My own experience, it has been a very, very positive one. I worry about the perhaps move towards centralising some of them, and I think, you know, we are a rural area. Villages and locality and having things local are important, and I hope the economics don't dictate that we have to become bigger and bigger and fewer and fewer.
That's quite a loaded question,
isn't it?
Stretched, and I think probably to kind of echo what Sharon said, really, that the more that the communities are stretched, the more we rely on these kinds of events to champion what it is we're all doing and to link up, really.
Yeah.
So I think that's largely what's, you know, vital.
Well, I don't really know very much about them. Sometimes it's quite difficult to make appointments. Yes, I mean, I make use of healthcare services. I'm diabetic, and I have problems with my eyes, and so the eye department seems to be very good. But you know, sometimes you hear bad things, people having to wait a long time. But at the moment, I haven't got any complaints about it.
I've not really had a lot of dealings with healthcare. Only very specialised. I've got a disease called myelodysplasia, which is bone marrow failure, and that was through anemia. So I use the Headland Centre in the hospital every week to have blood transfusions. That is my medical side, really, personally, of what I have every Thursday. So.
Well, my husband and I both had healthcare services. My husband's had a stroke and seizures, and I've had stents put in, and we can't fault them. We're really so happy with the service we have had. From the surgery to the hospital, we can't praise them enough.
My husband had prostate cancer and I had breast cancer, and to be honest, I couldn't have been looked after better.
No, I think things work quite well. I think the surgery is stretched now, as Dr. Cook was just saying. You know, there was 2 doctors when I started here, 2 doctors and a couple of receptionists and a couple of nurses. That was your lot. And now, you know, they've got 30 staff, he said. And with that, you don't get quite the continuity. And there's the usual complaints people make about, I can't get a doctor's appointment for a fortnight. But you can always get one if you need one urgently. But if you want to see a specific doctor, it could be up to a fortnight, which that's happening over the whole country. So I'm satisfied personally.
Yeah, really good. My wife and I do have to make use of the healthcare services from the time my wife's been type 1 diabetes since she was a child. The provision that's provided in Cornwall has been far better than anywhere else that we've lived. Certainly moving from some of London teaching hospitals, lots of problems were solved down here which were just ignored elsewhere. So 100% support for healthcare in Cornwall, and GP surgery is excellent.
I have found it to be A1. I'm currently under the hospital and have had appointment one after the other non-stop. It's been really great, and the surgery here, you can have an appointment whenever you want if you don't mind not seeing your own doctor, but you can see your own doctor if you want to wait for that. That's great. I've got no complaints at all.
On the whole, I think health services care is very good. One of my main concerns is in the summer, where the population is increased hugely, the demands that are put on the local hospital, Trelisk. I think it would be nice if that was taken into account by central government and they therefore allocated more resources, because I think the population trebles, doesn't it, in Cornwall in the summer? But the resources we've got don't necessarily meet that. And I think that's one of my main concerns. And I know again we have to look at resources where they're closing community hospitals. But I was listening to the radio today and they're saying only go to A&E if it's absolutely essential. That's fine, and I totally endorse that. But if they're in the meantime closing other community hospitals or centres where maybe that could be an alternative option, the supply and the demand have got to balance out. So yeah.
I actually think I worked all across Cornwall. Well, not all across Cornwall, but I worked for 10 years in North Kerrier. And I think actually the services across Cornwall are very good. They could be improved in some areas, but that improvement is happening. They're being reviewed all the time, and I think that's very positive. It's when you stay still and don't try to improve or evaluate what you're doing is when you get problems, and we do that all the time at the surgery. So I think, under the pressures we're all under, we all do a pretty good job.